Can you see my screen?
Yes, I can.
All right, so I'm going to be engaging in this class, right? Most especially, I'm just going to be breaking down the question, right? If you have any question in between, or if I am too fast, let me know. So I'm going to slow down, okay? So if you have any question in between, just ask me, right? Now, I'm going to give you the approach at which I approach uh, the NCLEX exam. The best way that will make you not to overthink, second guess yourself, and then doubt yourself. So follow through what I am doing because you can replicate the same thing I am doing when you have similar question to this, and then you will have success on the exam, passing in 85 questions. Now look at this question. The first thing I think, right, based on my understanding, is that this is a question on a particular surgery. Now, every surgical question, there's a particular teaching I have for surgical questions. You can use that particular teaching to answer any surgical question you have on the NCLEX exam. So now, if you are lucky, you have 5 questions under surgery. Guess what? You are capable of scoring 100% of that 5 question. Now, scoring 5 guaranteed over 85 puts you 80 question more. Now imagine now I've taught you about prioritization. You know prioritization very well. Let us say 50% of your exam is prioritization, right? And let us say 40 is taken out of this. You are able to succeed in 40 question prioritization. That's 45 over 85. You don't need too much, and then you pass the NCLEX exam. Easy. This is the secret I have been using to help a lot of students pass the NCLEX exam. Now, when I think about surgical question, right? It's not your duty to think about what the surgery is all about. It's only your duty to know the intended effect, right? Location, right? Based on the body system. If you look at this is the GI, right? Most especially, you might not know the intended effect, but once you look at the question, the answer choice, you might end up be be able to um know the intended effect. But intended effect is the list of everything the NCLEX can ask you. Most of the time they ask for most common surgery, but most of the time they don't ask. They more ask question that will make you question the location, right? Do your pre-op, post-op, and monitor for complication. This is the 5 things you need to know for any surgical question. Now, it's not your scope of practice to start thinking about colon recession. It's your scope of practice to think about those 5 things that I listed. So be blind to the fact that this is colon recession, right? Think colon recession to be surgery and think about those 5 things that are your duty as a nurse. Now, the nurse is assisting with the admission of a client scheduled for surgery. Now, we are not thinking about colon recession because when you think about colon recession, what happens? You start overthinking. Oh, what is colon recession? What is colon recession all about? What do I remember about colon recession? What the Rima told me about colon recession? What the Marquet told me about colon recession? Trust me, you are going to fall through overthinking, second guessing yourself, and then doubting yourself. And that's not what you want for the exam. Most especially if you are someone that cannot handle the pressure or anxiety. That's the reason why this is the most easiest way to think about it. Think about surgery, think about those 5 things you are going to learn in my program, which will help you in any surgical question, and then ask yourself, based on the understanding that I would have given you based on surgery, you will be able to tell that this question is testing you on pre-op. Now, every knowledge I've given you about pre-op is what you're now going to use. Now, before we go, we need to understand what the examiner is asking. Now, the examiner is asking which of the following statements made by the client would be most important for the nurse to clarify. So we are clarifying something based on post-op. Now, the first question said, I have urinary incontinence when I sneeze. The question is, they are talking about urinary incontinence when I sneeze. So the question you are asking yourself, will this be a problem in regards to the surgery that we are doing? Now, when do they have the urinary incontinence? When they sneeze. When they are doing the surgery, right? Most especially when they are going to be under general anesthesia. Are they going to sneeze during the surgery? No, they cannot sneeze. So this is not consigning, right? I had a successful cataract surgery 2 years ago. Yes, we want the surgery to be successful because if it's not successful, then I need to start asking questions. What happened? Then inform the medical doctor about the study that was not successful, then that's the problem. But now the study is successful, then I can eliminate it. But guess what? What will students be thinking about cataract study? You don't need to think about cataract study for this question because that's not your scope of practice. This is only what you're interested in. They add successful surgery. Because how do you want to start linking cataract surgery with colon recession? Nah, you will get to overthink, complicate the question, and then find yourself not even getting the question correctly. Right now, I take acetaminophen for occasional headache. During pre-op, we do medication reconciliation to see what kind of medication the patient is taking so that we know if there's any medication they have taken that will be a danger to the surgery. Most especially, we stop some medication before surgery. But one medication we don't stop is this medication. We don't stop it. So since we don't stop this medication, it's not nothing to clarify. Now, I usually have a few glass of wine in the evening. Most especially, I tell my students if you are able to eliminate three options, the last one is always the correct, or the remaining one is the correct, right? But let us understand it. I usually have a few glass of wine every evening, right? What happened to the wine? The wine could be alcoholic, and when it's alcoholic, what can it do? It can cause effects, right? It can cause problem to the surgery, most especially to the sedative agents. It can cause delay delay from let us say maybe okay, this is how I should put it. Let us say maybe you need certain amount of um medication to reverse the opioid, right? The sedative agents, but because of the alcohol, you might need more. So you will have delay in bringing back the patient to consciousness, right?
Oh,
So that is the reason why we don't want them to take alcohol before the surgery so that it don't cause problem with the sedative medication we use. That is what the nurse is clarifying. Is that clear?
yes. I
All
just
right,
need to
great.
repeat the location.
Hmm?
You said intended effect, location, pre-op,
Post-op
and oh,
and complication.
post-op and complication.
Complication, yes. So if you read about pre-op, you will understand a lot of things that a nurse do during pre-op, post-op, and as well complication. And this is how to study for the NCLEX exam. You cannot be studying about every surgical procedure. But one thing that is 100% sure is that every surgery that the medical doctor is going to carry out or the surgeon is going to carry out, they carry out with those surgery within the 10 body system.
Mhm.
Now, every surgery is attached to a particular body system. You name it, every surgery is attached to a particular body system. So now, when you want to learn pre-op, you learn pre-op in general. There's no separate pre-op teaching for different surgical procedure. Pre-op is the same for every surgical procedure. Post-op here as well too is the same for every surgical procedure, but complications are not the same for every surgical procedure. Instead of learning 300 surgical right procedure, you can easily learn 10 body system and ask yourself, if it is for the respiratory system, now say, what are the complications that one can have uh, in the respiratory system? What are surgical complications? What are surgical complications one can have for surgery done for any surgery done on the respiratory system? So you are going to have a general overview of
Mhm.
complications that can affect the respiratory system after surgery. So instead of learning 300 surgery, you only learn one body system and you have idea of many complications. Now, you might not know the complication that might affect colon recession, but you know it is GI, and you've previously learned about complication with surgery that can affect the GI. Most especially, they might tell you paralytic ileus. They might tell you hypo bowel sound. They can tell you abdominal distension. Now, this apply to the GI. So now, if you look at your option and the NCLEX is telling you after a surgery with a colon recession, patient started experiencing the below, which is concerning. Because you have a general overview of complication, you are going to see your answer among the list and easily select the answer that is related to what you know generally, even without not knowing what is specific to colon recession, and you are still going to get it 100% correct than going to go and learn 300 stuff. That is the reason why I help students to read, because most students don't know how to read. That's the problem most students have. They don't know how to study, they don't know how to read, they don't know how to make sure that studying is not complicated. That's why I help students to do. Basically, that's why I do. We do a lot of stuff, but that's just little of what I can say for now. Now, this particular question is asking about a procedure. The NCLEX said they are going to test about procedure. So, if you are to carry out a procedure, you need to know the way to carry it out and the special instruction related to that procedure that you need to do. Now, it's no difficult thing. In as much they said you are carrying out atrial blood gas, and the examiner is saying which of the following tests should the nurse anticipate will be performed prior to the procedure. In as much you've read about atrial blood gas, I am 100% sure you are going to come across number 4, because Allen test is what we do before we carry out atrial blood gas procedure. And the reason why you do this is because you want to confirm that the artery, when you press on the two artery, then release your hand, one can help the other one when the radial artery is in use, right? Basically, the radial and the ulnar artery, right? So we press tight on the both artery, then we release our hand from the ulnar artery. And when when you press tight on the hand, just like this is the hand right here,
Mhm.
right? This is the hand. When you press tight, this is the two artery right here,
Mhm.
right? When you press tight on the hand, you press tight here, you press tight here. Very soon, this red hand is going to become pale and white,
Mhm.
right? There will not be blood flow there. But immediately you release your hand from this area, blood is going to return back to the palm. Then it's going to be red back again. It shows that yes, when we are using this radial artery to carry out the atrial blood gas, even if there's blockage in this atrial, in this radial artery, the owner can still be returning blood to the arm without no complication. That is the reason why we do the Allen test.
Okay.
That is the function of that Allen test, to be sure that there will not be complication while we are carrying out the procedure, atrial blood gas. So the answer is 4. That's very simple and basic. Now, for this question, confidentiality. Which of the following information should the nurse suggest including select or apply related to this? The client is the sole owner of the medical record. The client is not the sole owner of the medical record. The client can review the medical record anytime. Look at this keyword, anytime, because there are some NCLEX questions that will say the client can only review the medical record so and so time. No, you can review the client can review their medical record at any time. There's no specific time they need to review their medical record. That is one thing you should know. One. Two, they are not the sole owner. The hospital is the sole owner of the medical record, but the client can request a copy of their medical record. They can ask to see or change anything in the medical record, but they are not the sole owner of the medical record. So this is out. Now, unneeded computer generative worksheets must be shaded at the end of the shift to ensure this. Correct. Now,
Mhm.
personal computer password may not be shared with anyone. Never share personal computer passwords, even with the member, even if you are working with the team that are working alongside with the client, you must not share computer password, personal ones. You can share information that the other members need to know that are working with the client. You can share other information, but personal password, your personal password, nah. So That's why this is correct. Now, keep your voice low when speaking with a client because direct interaction with clients must be kept private as possible. Yes, you want to keep your voice low, right? Medical information about the client may be shared with the police officer. Remember, I told you medical information, right, cannot be shared
Mm-hmm.
with the police officer,
Yeah.
right? The NCLEX is going to include the kind of information that need to be shared, right? If they say some medical information, then yeah, we might say okay, but they said medical. So medical is vague. We don't know the kind of information because the only information that we can share, as I told you, gunshot wound,
Mm-hmm.
stab wound. That's what you can share with the police officer. Now, with the public health services, you can share uh, STI,
Mm-hmm.
HIV example, communicable disease, TB. You can share that to the public health service. Now, other things you should also be able to share that is mandatory report: abuse, assault, rape, right?
Yes.
What else? Abuse, neglect, yeah,
Neglect.
you
Yeah.
must share that. So these are things that you can share. Aside that, there's nothing you can share, right?
Okay.
We have bodies that we can share them to. Police, you share gunshots with stab wounds, right? That is that for that. But now medical information, we don't know what kind of medical information now. So yeah, we are not going to do that because we don't know. It's vague. But if they specify, yeah, correct. So the answer is 2, 3, and 4. Great. Any question?
Mm, I got it.
All right, great. Okay, so now this question is talking about private room. Private room. We have one private room and we have 4 clients. Now, the charge nurse is tasked with the duty of assigning the only private room to one of these clients. Now, in order to assign client to private room, first of all, we must consider ADC, which is airborne droplet contact, before okay, we consider AD, which is airborne droplets. Then we also consider people that have immunocompromised, HIV, patients with chemotherapy, neutropenic, low WBC, right? Organ transplants, patients that are using medication that reduce the effect of the immune system, contacts, right? But the biggest people that we prioritize for private room, it all starts from airborne,
April.
followed by immunocompromised. Droplet can still be 3 feet distance, so we cannot really prioritize private room for droplet like that, right? Most of the time, I'm just saying, but this is like the priority. But if we have droplet patients on the list, yeah, definitely we are going to do that. But basically, those are the people we put in private room, right? Also for psych unit, people who put in private room are people risk for violence, self-harm, harm
Mm,
to themselves and others or the staff, right? Violence, right? We um put them in private or locked room. Right. In this case, we have patients with a blood trans transmitted infection,
mhm.
if I'm right, right? Hepatitis C. Now, this is positive varicella, but the question is this is titer. Titer is not 100% guaranteed. You still need more tests to confirm titer. If titer say positive, it might be that this patient have a live vaccine that is showing that they have varicella, but they don't really have it. Anything titer is not 100% guaranteed.
Okay.
We still need more tests or to see that this patient really have what they are saying. So if you see anything positive titer is like maybe there's a vaccine or maybe there's something, maybe this patient have this situation, but the immune system still got it under cover. So titer is not really guaranteed. We have droplet and blood transmitted infection. So if you are dealing with droplets and infection that is transmitted by blood, which one are you going to prioritize? You're definitely going to prioritize the one that is um transmitted by
Well,
droplets, because it's easy to get droplet than blood. I mean, if you walk on the street today, how many people are you going to see and you are going to have direct contact with their blood?
hardly.
Probably none. But it's easy to see somebody that is sneezing, coughing. So what are you going to prioritize easily? Droplet or blood? Droplet. So droplet is going to own this uh
Um,
private room because it's droplet we have right there, which is pneumonia, right? So the answer is three. Any question?
no, I'm good.
Okay, great. I will still test you on this private room
Okay.
after the end of this Zoom. Okay, now, so yeah, basically, we are dealing with COPD. Remember, I told you about focus when it's just the diagnosis. Here, they are testing on COPD, right? The diagnosis. So, obviously, the NCLEX can test you anything on that condition. So, the question is saying which of the following interventions should the nurse suggest, including in the client plan of care? Now, I said something recently, restrict the client fluid intake to 500. There's no point of overthinking here. The question is, you need to know those conditions that will restrict fluid. COPD is not among those conditions that will restrict fluid. If the doctor will restrict fluid for COPD, it will be on special concern, and the NCLEX is going to include it. COPD is not among the conditions that will restrict fluid. COPD is a problem with the respiratory rate, not fluid problem. So it is not necessary here, right? Except if indicated in the question. Since it's not the primary issue, it's not compulsory. Now, the NCLEX said place a client in low Fowler position for meal. The question is, do we place client in low Fowler for meal? No, the position for feeding the patient is high Fowler. So this
Yeah.
is wrong. Now, provide high carbohydrate diet, high carbohydrate snacks. Just the same way the NCLEX said you should restrict fluid, and we know that is not an issue with COPD. That is the same way we ask ourselves, is this patient having a situation that we need to provide high carbohydrates?
Mm-hmm.
No, they don't have hypoglycemia, not even related to the endocrine. This is a respiratory problem. They don't need this. Maybe because of COPD, they have problem to do with energy burning so fast, and then we might give them high calorie, but not sugar. High calorie and carbohydrate is different. High calorie good, high carbohydrate no. We don't. They don't have problem to do with sugar. So as I said, if you've eliminated three options and the last option will definitely be the answer. But yeah, let's look at it. Provide the client small frequent meal and schedule rest period before and after meal. Very important
Yeah.
for any condition, not only with COPD, for any condition. It is a correct answer for any condition because that is the best way you encourage the patients to eat. Small, frequent meal and schedule rest period after meal, right? That is a good thing to do. So that would be the best, right? So
Yeah.
I don't need to start thinking. You see, when I'm answering these questions, I'm not thinking, oh, how does this fully relate to this condition? I'm not doing that overthinking. I'm just using the proper critical thinking with what I have here.
Mm-hmm.
With what I have here. For every condition, the NCLEX wants you to know everything about that condition, most especially making it related to the pathophysiology, assessment, intervention, and evaluation. This can save you for every med search question in the NCLEX exam. If you learn about assessment, you will know how to assess. If you learn about intervention, you will know this is not part of the intervention. You might want to feed, but you put them in high Fowler position. We don't do this. We give them high calorie and we do this. So that's how you're going to understand the question, right? An evaluation, they might say, okay, what shows that the patient is maybe most consigning, or maybe the patient is improving, and they say, okay, patient that had 28 breaths per minute and now they now have 18. They will say, okay, patient is improving. Or they say, what is most concerning? And they say, your patient have 86 oxygen saturation. Then that's the problem. Now, I want you to tell me, what is the normal range for oxygen saturation for a patient with COPD?
88%.
What is the
To
normal range? Range.
um like 95 to
What is the normal range for COPD? I told you the other day.
I think you said 95. 88.
You are not studying because I told you keep studying this every day. Range. This is not range. This is not range.
88 to
This
92%.
is just a single number.
88 to 92%.
All right. 88 to 92%. This is a range.
Mm-hmm.
When they tell you what is the normal range for blood pressure, 120 over 80 is not a range. This is just a value, 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 value. This is a range. What is the normal range for blood pressure? The normal range for blood pressure is 100 to 120 systolic and 60 to 80 diastolic. Because a patient can end up being within this and within this. That's why you can see patients having, like the last question I gave to you, they said the patient has 100 over 60, I guess,
Mm-hmm.
right? Over 68. The last question I gave to you. It shows that the 68 is within 60 to 80 and the 100 is within 100 to 120. So anything lesser than 100 is hypotension.
Mm-hmm.
Now, anything that is greater than 120 is what? Hypertension.
Mm-hmm.
Okay. What is the normal range for WBC?
5,000 to 10,000.
All right. 5K to 10K. Great. What is the normal range for respiratory?
12 to 20.
12 to 20. What is the normal oxygen saturation?
Uh, um,
What is the normal oxygen saturation?
n- 95 to 100.
95 to 100.
Mm-hmm.
All right. What? Okay. Let me leave it as that. Okay. What is the normal heart rate?
60 to 60 to 90. Or not,
60 to
60 to
100.
100. Yeah, 60 to 100.
All right. What is the normal hemoglobin level?
Mm,
Just say anyone.
Um, 12 to 16.
Okay. 12 to 16, 14 to 18, male,
14.
female. Okay. All right. Let's leave it as that. All right. I just want to try to give you a reminder because it's very important for you to know. Most especially, they are going to come back to what you in your case study. Now, this is a surgical procedure repair 3 hours ago. Now they're asking for the intended outcome. The intended outcome. Now, see something. I used to tell students that, oh, you might not likely know all your intended outcome of the question, but there's possibility that you might likely know, right, the intended outcome from the option,
Okay.
right?
Mhm.
Now, look at what they said. Surgical repair. We have different kind of surgery. We have surgery for treatment, right? We have surgery for investigation. We have surgery for repair. It's just like now, what do we do for hernia? Do we treat or we repair? We repair. Now,
Okay.
when they tell you to repair something, the hernia is just like, oh, this is the person's stomach. Big, the hernia is big, like they repair it. Now, when they tell you about repair, there's something they want to repair. Do you repair pain?
No.
Okay, obviously, that is just critical thinking. I'm taking that out, right?
Mm-hmm.
Do you repair? Let me just say something. Now, let me just give you another hint right here. They said relief from pain. The intended outcome cannot be relief. The intended outcome cannot be relieved. The intended outcome will be something superficial first before the symptom that comes out with it.
Okay.
Anything that they want to repair, something superficial first before the symptom comes out with it. Right? It's just like right now, a lady with tumor in the uterus. Sometimes the doctor can just be observing it, observing it, observing it, and see when it has gotten to a particular point that it might be a danger, and then schedule that lady for surgery. It has not yet started causing problem, but the doctor is observing it. Why is the doctor waiting so long? But at one point, the doctor did not allow it to cause complication before he took it out.
Mhm.
Probably you might not have been experiencing pain. Maybe one particular time you just had to do routine checkup and the doctor noticed that, right? And the doctor kept on monitoring. Are you feeling pain? You say no, but you have the tumor. What you are saying no, you are not feeling pain. So now the doctor is removing it, not because of it has started causing problem. So it's not until something is causing a problem before you can repair it. You can even repair it before it starts causing a problem. So relief of something is not the reason why we are repairing. We are repairing it because it can cause this. It might cause that, maybe, but I'm just saying we are relieving. Relief would be because it can cause that and that. But the question is, when you want to repair, you are repairing because you want to do something before the symptom. So the answer will likely be between 3 and 4. That's what I know. I'm trying to teach you how to answer some certain questions like this, even if you don't understand what it is or you've not heard about the word. But if you know like some vital keys, you can be able to still answer the question, right? So to me, I would have eliminated this. I will be left with 3 and 4. Now, I will pick 3 as the answer. Tell me, why do you think I will not pick 4?
To achieve to achieve an erection.
Tell me, why will I not pick 4? I don't know if you are thinking the way I'm thinking, but my question is this is okay. This is a child.
Mhm. Right.
Now to achieve erection, I'm like a
Mm-mm.
child erection at this age, and now
No.
probably the answer will be more of ability to avoid while standing. No, erection. That is how I'm just going to be thinking about it. Right? What I'm teaching you, it's not something that okay, you should use it as a practice. I'm only just teaching you situation whereby you might be lost in a certain question, but you can still find a means to answer the question. What we do as a nurse is just to critically think. Basically, we don't necessarily need to think right, but we need to think almost right and still come out with the certain or the correct answer. So I'm not thinking right, but I'm thinking almost right. But I still came up with the answer. But to save all that, if you understand this surgery, most especially when you study pediatrics, care of pediatrics, you would have been able to come across this problem and then find out that they fix this problem with surgery. And then when you find out about the intended outcome, you will notice that theory is the answer because pretty much they don't have obstruction. They pretty much pass urine so well. They don't experience pain. They have erection. But the only problem is that this is the penis, right? This is the penis.
Mhm.
Normal penis, they pass urine directly right here. But
Mhm.
for patients that is having this condition, the the opening of the penis is down of the
Mhm.
penis, is not in front, it is below. So now
Okay.
it will be difficult for them to pass urine when while standing, when the opening is not here and the opening is down. So we want to like help them out. Most especially, we are just correcting the location, because now let us say this particular child is with their peers,
Mm-hmm.
right? This is the child friend. And all of a sudden they want to pass urine and then they find out that the urine is dropping from below right instead of in front. They can be laughing at them. So we also use it to help the child from psychosocial issue among their peers,
Okay.
right? That's also something that you should know. So most especially, right, if you know about the condition, it's nothing to do with obstruction, it's nothing to do with pain, it's nothing to do with erection. So if you are thinking about anything, this is the answer you still follow. So I'm
Okay.
just trying to like say try as much as possible to help you out with a lot of thinking. Now, this is another thing we are getting right now. Another sample, sputum specimen.
Mm-hmm.
And anytime they're asking you for sample, that's the reason why one part of my course program, right, teaches what are they calling it? Students. One part of my course program teaches students on sample collection, so that any sample collection you come across on the NCLEX exam, you are able to know the instruction, most especially what you need to know as an entry level nurse,
Okay.
right? Important. So great, let us do this. Now, sputum specimen. A lot of students said the answer is two. That is wrong. Place the specimen in the refrigerator until it can be transported. What we want to do as a nurse or instruct the patient, I don't know, is in as much you get that sputum, right, immediately send it to the lab, no delay. Except if the NCLEX includes something in the question that says there could be a delay. Now, what are you thinking if there's going to be a delay, right? Sorry, sputum. What are you thinking if there's going to be a delay, right? You can refrigerate it. But the NCLEX did not specify if there's any delay. So the instruction is always to take it to the lab immediately.
Okay.
All right, great. Before sputum specimen, we want to encourage the patient not to eat, right, anything from midnight,
Mm-hmm.
right? Two, they should take the sputum specimen in the morning, first thing in the morning before eating as well. Too, they should not eat, right? We don't want to give any medication, something that can maybe alter the specimen. No, we don't want to take that risk. So no medication. We don't want to do this because there's no reason to do that, right? They said obtain the sputum specimen before the client go to bed. No, we don't do it before the client go to bed at night. We do it in the morning. Understanding that three is the answer. Tell the client to rinse the mouth with water before specimen collection. Now, a particular student asked me, "Oh, coach, why do we encourage the nurse to, uh, sorry, the patient to rinse their mouth? It's because of there's a lot of microbe in the mouth. So, in order to reduce the amount of microbe and we don't have to cause a lot of stressful situation in reading because it will dictate a lot of things, but most especially we want to be straight and direct to the sputum specimen. To reduce the amount of microbe, we do that. We tell them to rinse the amount. So some students also ask, okay, but what if they end up rinsing what we are going to dictate for the sputum? The thing is you cannot rinse what we dictate. If the patient have the infection you are trying to dictate, it's
Mm-hmm.
still there. Nothing can change, right? Nothing can change, even if you rinse the bottle. So that is that for that. Clear?
Understand.
All right. So yes. Now I was talking about delegation in my last video.
Mm-hmm.
Sorry. Prioritization. Now prioritization. Now I was doing delegation question with a particular student. Yeah, I'm right with what I said. Delegation now. I said prioritization before, so I'm saying delegation now. The particular student was like between atrial fibrillation and then respiratory distress. And the student said, ah, I don't know if it's atrial fibrillation because a patient with atrial fibrillation will start having increase. I stopped her right there. I said, hold it, stop. You are giving yourself problem. The NCLEX never said the patient have atrial fibrillation. Let's go back to the question. Let me see if I can see that question real quick.
Okay.
And we are going to come back to this.
Okay.
Let me see. UAP, UAP, UAP. If it is right here or not. Oh. It's the question is not here. The question is in the RN past question, not the nursing past question. The
Oh,
RN past question. So it's not here. So I will not be able to see it. Okay, but that is what I was saying. Atrial fib and respiratory depression. Now
yeah.
the student was not like, oh, I was thinking a patient with atrial fib will start developing. The question is, did the NCLEX say that the patient is having increased respiratory rate? Why are you adding information that is not part of the question? This is how a lot of students cause themselves a lot of trouble. The NCLEX say the patient have hypertension does not mean the patient is not stable. The NCLEX say the patient have diabetes does not mean the patient is not stable. The question is, what are they experiencing that is making them not stable? You prioritize with what they are experiencing, not the condition.
Mhm.
The condition can be the cause of what they are experiencing, but the condition don't automatically make them unstable. Never use ABC on the condition. You will get it all wrong. You can use ABC on what they are experiencing, not on the condition. And even with what they are experiencing, you still need to make sure you ask yourself, what is the root cause? Everybody can have dyspnea, true or false. If you
True.
go to the gym now, you get extremely tired, you will have difficulty in breathing. You
Yes.
can have shortness of breath, but you are going
Mhm.
to recover from it back again when you rest, because the root cause of this dyspnea is because you went to the gym. You are tired, you did exertion, when you rest, the dyspnea is gone. But a patient with COPD that is having dyspnea, the dyspnea might not end up stopping if the dyspnea is related to the COPD, if the root cause is the COPD. But if the NCLEX say they have dyspnea with exertion, then the root cause is not COPD no more.
It's the
Instead, the root cause is the exertion.
mhm.
So the instruction you are going to do is to say, patient, you need to rest. You are doing too much, right? That is the
That's
reason why we encourage every client to make sure they do 30 minutes of exercise, nothing more, 5 days a week.
mhm.
Positive exercise for any kind of condition, right? So now, symptom is what you prioritize, what they are experiencing. Now, this patient is having this, having this, having this, having this. These are all the condition. This is the symptom. This is the symptom. This is the symptom. This is the symptom.
Mhm.
Now, they are having insomnia. The insomnia is not caused by this condition. Instead, the root cause is the medication, because they said the insomnia began after they had their amoxicillin. So the question is that a problem? Now, I also used to tell students that anything that you cannot treat, but you need to give them special instruction is not priority. That can wait.
Okay.
That can wait. In this case, there's possibility that maybe you might treat this, but can you treat this as place a crayon in the cast? Can you treat that?
No.
You only give special instruction. Oh, patients, it will be bad idea for you to place crayon in your cast. Instruction. When some people need medical attention right now, this patient can wait. Let's put a maybe on this one. Now, report skin irritation. Yes, you can treat this. You
Mhm.
can do something about that. But is it concerning? We don't know. Maybe. Now, they said has pink fluid sputum. Right. Sign of pulmonary edema. Now,
Yeah.
maybe. So now we can be able to eliminate this that we cannot treat, but give special instruction. But now we have 1, 3, and 4.
Mhm.
Now, what is priority? Insomnia, which is what they are experiencing, skin irritation, and this. If you look at it, This cannot kill the patient, this cannot kill the patient, but pulmonary edema can kill the patient. And that's why the answer is 4. Very simple.
Okay.
Very what? Simple.
Well,
NCLEX should not be difficult because NCLEX is very easy to answer, right? The NCLEX question is very easy to answer, right?
correct.
Okay. Now, anytime the NCLEX is asking you about procedure, most especially the intended outcome of that procedure, or maybe they are asking you the most important thing about the procedure, right? The most important thing about urinary catheter is not because it's going to help the patient pass urine. The most important thing about urinary catheter is that we want to reduce the risk of urinary
Mhm,
infection
mhm.
by making sure that we place the bag in a dependent position, and that position is below the bladder.
Mhm,
So if they ask you for the most important thing sometimes in regards to a procedure, right? Most especially, maybe they tell you you are inserting urinary catheter. The most important thing is the sterile procedure. Doing it in a sterile environment, making sure that everything you are doing is sterile.
mhm,
Donning your sterile glove, okay, performing your hand hygiene with soap and water, donning your sterile glove, sterile. When you are inserting, when you've inserted it, the most important thing is infection. Now, this is skeletal traction. What is the most important thing? The most important thing as well is maintaining the intended effect, making sure there's proper alignment with the leg. And how do you make sure there's proper alignment? The priority thing is to make sure that you monitor the pull, because there's a pull on that leg to make sure
mhm,
that alignment is maintained. If that pull is not as the doctor fix it, then there will be problem with the alignment, which will cause the patient to repeat the procedure again. And we don't want that. So that's the reason why the most priority thing is the intended effect of that procedure, the intended, what we expect the procedure to do for the patient, which is the alignment. That is
mhm.
priority, right? So that is the answer. The answer is 2. That is the priority, the intended effect. Now, the last question we are going to do, which is MI, collecting data, right? Following findings that will be consistent. The NCLEX said they are going to test on collecting data. I was doing it with a particular student yesterday, right? Concerning collecting data, the NCLEX is definitely going to test that, collecting data. So the student should be able, which you are among, right? You should be able to know those important data that are very vital to each condition, most especially those most popular conditions that are life-threatening, right? Because the NCLEX will most test you for those ones that are more safety concerned, the most important data. And I have a lot on the program for you to know, right? Most importantly, what will be consistent with this condition is nausea and vomiting, diaphoresis, and dyspnea. This is not related to it. This is not related to it.
Yeah.
2, 3, and 4. Okay, great.
Mhm.
Yeah, we're definitely done with the session. So, how was it? You
It was,
learned.
yes, I did.
Great. I'm happy that you learned a lot
Yes,
from
yeah.
this. Now, so if you will say something in few words, what are you going to encourage people that are struggling with the NCLEX exam?
Uh, not to overthink what's within the question is that's what you focus on. And depending what type of question it is, rather if it's a procedure question or a sample question, just focus on not only on the diagnosis, but what the intended for that, question
Mhm.
that is needed. So
Okay,
that's
now,
the thing.
all right, great. So now, after this whole lecture, what would you do better now?
Um, is not to overthink. That's my problem. I get to two questions and I'm stuck, or and I'm adding, or I'm saying what if. But my thing that I'm working on, and I see that I'm doing well with it, is focusing on what it's
Mhm.
asking. If it's a
Great.
procedure or an outcome or what is intended for a medication, look out,
Mhm.
look at the complications.
Yeah,
the complication, then, or if they're asking for, we were just doing it now, the side effects, what is
yeah,
included with the medication, but they're asking what is priority. So it's the complication, the
yeah,
adverse effect.
complication. Yeah,
Right.
exactly. The
So,
adverse effect. Yeah.
right. So that's what I'm gonna be working on.
All right, great. I'm happy that you understand how you are going to take a new approach in answering the NCLEX question. Most especially, as you said, no overthinking. The information that is on the question is enough. Don't add anything.
Right.
Leave it as it is. You can interpret the data, but don't add what is not there. Okay, this means a neighbor that maybe obviously there's a rupture and then it is red
Hmm.
hemorrh- hemorrhage, there's
Yeah.
blood under the nail bell. That is an interpretation. Not by saying, oh, because the patient has a nail bell, they will have this complication and that complication. The question did not tell you they have complication. They only said they have a nail bell problem.
Right.
You understand the thinking?
Right.
You can interpret the data, but you cannot add to the data. You can
Right.
say, oh, a patient with hypertension, their blood pressure is going to be in, increased. But don't
Hmm.
say if their blood pressure is increased, they will be at risk for stroke because stroke was not part of the question. So why adding stroke to hypertension when they only gave you hypertension?
Hypertension. Absolutely. Hmm.
Right? And a patient with hypertension, yes, their blood pressure will be increased, but do their blood pressure get increased all the time? The answer is no.
No. No.
Only if the patient is not managing their condition well, that is when you can have uncontrolled blood pressure reading.
Hmm.
But they are expected to manage their condition well. So a patient might have a chronic condition, HTN, and have a normal blood pressure reading. So wait until the NCLEX starts saying their blood pressure is high. You understand that, oh yes, hypertension have to do with increased blood pressure, but the NCLEX is not telling me right now that the blood pressure is high. So the patient is automatically stable until they tell you that.
Hmm.
A patient with diabetes, their blood sugar is always high, not always used to be high based on the condition, right? But not always high if they are managing their condition well. The question is the NCLEX telling me that the blood sugar is high? No. I will wait until the NCLEX include it. I will not add that information.
Right.
Simple. So yeah, I really thank you for joining this session. Um,
Exactly.
yeah, and I hope you learned a lot from the session. So